The goals of lung cancer screening are to detect lung cancers at an early stage where we have better options to treatment. That being, sometimes we can do lung-sparing cancer surgeries for the lung cancers, or we can use minimally invasive techniques such as the Da Vinci robotic system. Lung cancer, unfortunately, is a silent disease in early stages. So even patients that have lung cancer, they may not necessarily have symptoms. So it's important to get screened so that we can find a lung cancer at an early stage where it doesn't produce any symptoms, and we can better intervene on them. So lung cancer screening is basically composed of a CAT scan once a year. It's a low-dose CAT scan, so it has decreased amount of radiation compared to a regular CAT scan. And it's usually ordered by either your primary care doctor or your pulmonologist, and it's once a year for basically as long as the patient is willing to get screened. Early detection of lung cancer is really important. Why? Because the survival of lung cancers at a very early stage are significantly better than even just when the lung cancer has started to spread within the chest. So for an early stage lung cancer, 5-year survival can be upwards of 90%. Versus if a lung cancer has already started to spread within the chest, that number goes down to about 30% at 5 years. So the prognosis for early stage lung cancer, stage 1 lung cancer, is very, very good when we are able to treat it. 5-year overall survival for an early stage lung cancer is upwards of 90%. I think lung surgery has really progressed by leaps and bounds in the last 20 years. There are many new technologies that weren't available previously that enable us to do lung cancer surgery through very small incisions. That includes a Da Vinci robotic system. The patients tolerate these procedures much better than in the old days where they would end up with very large incisions across their chest. Those incisions usually were associated with a lot of pain, a lot of discomfort, and that's really not the case anymore. So in general, these minimally invasive techniques that we use now for lung cancer surgery allow the patient to have surgery with pretty low pain after surgery, and also at hospitalization ranging from 2 to 3 days. In addition to that, because of these more advanced systems that we're using these days, we have progressed in our ability to do lung-sparing surgery. So whereas previously we may have to take a large amount of lung in order to treat a small lung cancer, nowadays we're able to take a smaller amount of lung, which preserves lung function for the patient in the long term. I think it's important for patients to know that throughout the RWJBarnabas Health system, there are multiple centers that are accredited by the American College of Radiology for lung cancer screening. There are some centers that even have formal programs where lung cancer screening is offered in conjunction with smoking cessation, which is really important. But regardless of whether the program is formal or not, there are many centers within our system that are accredited for lung cancer screening and are accessible to the public.